Today we will be discussing in this demonstration on the nasal cavity and the nasal septum. To understand the nasal cavity, you have to know that we are going to take a sagittal section, and this is the external nose. So this is the root of the nose, this is the tip of the nose, and this will be the ala. So there will be an opening that is called as nostril. So below the septum there is an area that is called as philtrum, and this nostril will be communicating with a tuft of hair that is called as vibrissae, and that area is called as vestibule. When you try to take a cut section in the midline, we will be able to see there will be a nasal septum. So whatever you can see from outside is called as external nose. Once you take a cut section, whatever you will be able to see, that is the internal part of the nose. Now we will go to internal part of the nose. So if you try to see the internal part of the nose, this is the nasal septa. So if nasal septa will be having a roof, it will be having a floor, it has a anterior part, it has a posterior part. The opening in the front, where I showed you the nostril and the vestibule, is called as anterior cohine, and the opening which is there behind, that will be going to form the posterior cohine. The posterior cohine will be continuous with the nasopharynx. After posterior cohine, whatever part up till to the soft palate comes, that will be the nasopharynx. Nasopharynx will be continuous with oropharynx. Now we will just touch upon the nasal septa. So this will be consisting of both cartilaginous part as well as bony part. So if you try to see the cartilaginous part, this will be formed by the septal cartilage, and above it will be formed by perpendicular plate of ethmoid bone, and below it will be formed by vomer bone. If you try to see the roof will be formed by cribriform plate of ethmoid bone. This is the cribriform plate of ethmoid bone. You can see some fibers which are coming, that is the olfactory nerve endings will be there. This olfactory neurons will be going to the olfactory bulb, and then it will be going to the olfactory tract. So this is area which is there above is called as the olfactory zone. Rest of the area will be the respiratory zone. All this will be the cartilages and the bone will be covered by mucous membrane. Next, if you come to the anterior part you have the nasal bone and also the septal cartilage which will be coming, and then comes the alar cartilage. If you come below the floor, you can see a bone here. This septal cartilage will be attached to the palatine bone. So you have the hard palate. So hard palate is constituted by palatine process of maxilla and also the palatine bone. And if you go posteriorly, you can see the soft palate attached to this hard palate. Next, if you come above, you can see a cavity over here, that is the sphenoid. This cavity is called as the sphenoidal air sinus. And you have the vomer bone which will be present here. Next, in this septum, so if you try to see this area, anterior inferior quadrant. Usually we classify into 4 quadrants by imaginary line, that is a vertical line and a horizontal line. This is the anterior superior quadrant, this is anterior inferior, this is the posterior superior quadrant, this is the posterior inferior quadrant. Anterior inferior quadrant will be having an area that is called as Little's area. This little area is the area where there will be anastomosis of vessels, that is the septal branch of facial artery, anterior ethmoidal, greater palatine and nasopalatine arteries. So this is the area where there will be epistaxis. So these are the things which will be coming in the nasal septum. You have to read about the nerve supply, the blood supply and the lymphatic drainage in the theory, but whatever you can visualize is this only. So next we will be going for the lateral wall of the nose. This septal cartilage will divide the nasal cavity into 2 parts, right half and the left half. So when you take the cavity, it will be having a medial wall that is formed by septum, whereas the lateral wall we are going to see now. So if you try to see the lateral wall, The lateral wall will be having again a roof. It will be having an anterior part, it will be having a posterior part, and it will be having a roof floor. So the posterior part will be continuous with nasopharynx. You can see some projections here. This projection is called as the concha. So there is superior concha, there is a middle concha, and there is a inferior concha. Among all this, the inferior concha will be an independent bone. So this is the inferior concha, which will be an independent bone. The space between the concha is called as meatus. This is the superior meatus, this is the middle meatus. This part which is there where I am crossing the probe is the inferior meatus. If you come in front of this concus, you can see again this area where there is vibrissae. So this is the vestibule, and this area where in front of inferior turbinate you have the agar nasi, and you can see where the middle turbinate is attached, you have the Lyman nasi. So these are the areas which will be coming in the lateral wall. Now you have to remember the superior meatus will be having an opening of a sinus, that is the paranasal air sinus, that is posterior ethmoidal sinus. Then the sphenoidal air sinus where it opens, you can see this is the opening of sphenoidal air sinus. This opening where it opens into the nasal cavity is called as what we call it as the sphenoethmoidal recess. Sphenoethmoidal recess. If you lift the middle concha, you can see there is a bulging and a depression. This is the bulging is called as bulla ethmoidalis, which will be containing middle ethmoidal sinuses. The depression which is there, you can see a depression which is almost horseshoe shaped. This depression is called as hiatus semilunaris. So in this hiatus semilunaris we have from above frontal sinus will be opening. Below if you come there will be the maxillary sinus, and also the middle ethmoidal sinus and anterior ethmoidal sinus will be opening into the hiatus semilunaris. And if you try to see below here, you can see this is the inferior meatus. This inferior meatus will be having an opening of nasolacrimal duct. So whatever the tear gets produced will be drained into nasal cavity by nasolacrimal duct. Next, if you try to see apart from this superior meatus, middle meatus and inferior meatus, sometimes there will be extra concha. Here, if I am lifting the mucous membrane, you can appreciate a concha here. You can see a concha here that is called as supreme concha, and there is a meatus there that is called as supreme meatus. So this is an additional concha and a meatus which will be there above superior concha in some individuals only, and that will be having sometimes opening of the posterior ethmoidal air sinuses, or sometimes there will be opening of the sphenoidal air sinus. So these are the things which will be there in the lateral wall of the nose. Again, lateral wall is divided into 4 parts: anterior superior, anterior inferior compartment, and posterior superior, posterior inferior compartment. Each quadrant will be having different nerve supply, blood supply and lymphatic drainage, which you have to read. Once we remove the mucosa, we will be able to appreciate each part. If you take the function of this nasal cavity, it will be helping for entrapment of the dust particles, and also it will be helping for humidification of air, and it will be protecting from the dust and the external antigens. So these are the things which you have to know in the demonstration part of the lateral wall of the nose. So thank you for watching this video.